Okay, so for this video, I'm going to talk about the 4 sites of intramuscular injections, also known as IM injections. So the first one I'm going to talk about is the deltoid injection, and this is where we identify the patient's acromion process, and it's about right there, and we place 3 fingers below the acromion process. We lift that 3rd finger, and so the injection would go about right there. Okay, so now for the dorsogluteal injection, it would actually be on the posterior side. So if you could please lay on your belly. Okay, great. So for this injection, we actually have to be careful because we want to make sure we don't hit the sciatic nerve. So what we do is we would draw a quadrant on the buttocks like this, and the injection would go on the upper outer quadrant, making sure not to hit any nerves. Okay, great. So now if you could flip back to the other side and then lay on your left hand side. Okay, great. So if you could put your arm towards you. Okay. So for this injection, I'm actually going to talk about the ventrogluteal site, and this is actually a common IM injection. So if I'm on the patient's right hand side, I would use my left hand and I would feel for the greater trochanter of the hip, and I would place the base of my palm there. I would orient my thumb towards the groin area. I would then take my index finger and stretch it out to the anterior superior iliac spine. Then my middle finger, I would stretch it out towards the iliac crest, and then the injection would go in between these 2 fingers. Of course, before I place the injection about there, I would remove my fingers. Okay, great. Now the vastus lateralis, if you could flip over to the other side. Go ahead and just hold your arms towards you. So this injection actually goes on the upper thigh, and sometimes it's used for children because in children those muscles are a little bit more developed. So we would palpate, or obviously if the patient didn't have clothes on, we would place one hand about right there. Then I would place my right hand right above the knee. So right hand right above the knee, left hand here, and the injection would go about there. That would kind of be the midway point between where my 2 hands are, and it would be at the very far end, and that would be the vastus lateralis IM injection. Okay, great.
I didn't realize it was going to be all of